We hear so much about blood pressure and why it's so important to keep it within a healthy range. But the question is, why is blood pressure really that important to the health of our bodies? About 1 in 3 adults in the U.S. has high blood pressure, but many don't realize it. High blood pressure is sometimes called a silent killer because it usually has no warning signs, yet it can lead to life-threatening conditions like heart attack or stroke. The good news is that high blood pressure or hypertension can often be prevented or treated. Early diagnosis and simple, healthy changes can keep high blood pressure from seriously damaging your health. We talked to Dr. Nitza Alvarez at the Tri-County Heart Institute about the important relationship between your blood pressure and your cardiovascular health.
High blood pressure is the most and easiest preventable cause for cardiovascular disease. That's why we are so emphatic about screening for high blood pressure, treating high blood pressure, because we know that it's so simple to identify and to treat. It's called the silent killer because you're not necessarily going to have symptoms when you have high blood pressure. There's no symptoms. Some patients might have some, but the majority of the patients with high blood pressure do not know that they have high blood pressure unless somebody checks their blood pressure. Why do we worry so much about high blood pressure or hypertension as part of the cause of cardiovascular disease? As an example, we use the pressure that the vessels are experiencing when the blood flow is going out. That is called the systolic blood pressure, or the top number. When the pressure that those walls are experiencing when the heart is relaxing is the bottom number, that is called diastolic blood pressure. We know that high blood pressure has been related to cardiovascular disease. So whenever we see patients with high blood pressure, we know that those patients are going to have a higher tendency of developing plaque in the arteries. And if we can control that blood pressure, then we can reduce the chances of forming plaque and also helping with the elasticity of the arteries. Patients with low blood pressure can go from a range from this is completely normal, from a range that you should see a provider or a specialist because there might be something wrong with you. The best thing to know if this is something that I should worry about is, number one, do you have symptoms with your low blood pressure? Do you feel okay with low blood pressure? Because we all have different blood pressures. If you are an athlete or you're young, you tend to have lower blood pressure. So our blood pressure fluctuates. It depends of the person, what their diet is, what they do, how much they do, how little they do. We know that we use a top number of 140, the systolic blood pressure, as kind of like the upper limits of normal. Beyond that is hypertension, but we don't have a low number that we can say this is too low. No, we always said symptoms. Are there any symptoms related to that? Symptoms that we're looking for are mostly I'm lightheaded, I feel very short of breath, or I don't have any energy to do anything. More often than not, we can take care of it. Interestingly enough, I do, as a cardiovascular specialist, we deal with the extremes. Now we can deal with a very low blood pressure, very high blood pressure, or in between. But it's funny when I had to tell my patients with low blood pressure, please eat salt. That is what's going to help your blood pressure to come up. And it's funny when it comes from a cardiologist, I say, out of 100 patients that I see, 99 I'm telling them do not eat salt. And then to you, I'm like, please eat salt. There's very simple things that we can do. Of course, you want to discuss with your provider if this is appropriate for you or not.
Some things you can do to keep your blood pressure in check: maintain a healthy weight, get physically active, eat a healthy diet rich in vegetables, fruits, and whole grains, and low-fat dairy, cut down on salt, drink alcohol in moderation, if at all. Don't smoke, and get a good night's sleep. Walk with a Doc has been on hold for a couple of months while the community adjusts to the COVID pandemic, but follow Tri-County Heart Institute's Facebook page for the most current information. Once they resume, you can join Dr. Alvarez the second Saturday of the month for Walk with a Doc. Participants will enjoy a brief presentation on an important health topic, followed by a walk at your own pace led by Dr. Alvarez. You'll find information on Walk with a Doc and the Tri-County Heart Institute when you click the Blood Pressure Explained story link icon online at yourhometownhealth.com.